Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good morning. Welcome to Open Your Eyes.
Start your morning right.
I'm Marlene Cuellar.
And I'm Gavin Courtney.
And thank you for joining us this morning.
It's a really beautiful morning.
Yeah, a bit of showers.
Well, I didn't see any on my way here. But I was, I say it all the time on the show, but I'm really proud of everybody who gets up and exercises in the morning and goes running or cycling or whatever it is, because I can't be. I mean, I get up to come here, but that's, but I can't imagine. Yeah, I mean, I can't imagine like putting much more energy into the first, like, let's say, right after I wake up.
Yeah. And I think the morning is the best time, just because it's like an automatic habit that you can build. You wake up, you go out, rather than like having that break in your day. You get home from work and you're like, okay, I'm gonna go.
Yeah, well, I mean, my thing is that I just can't, when I wake up, I mean, like, that's the first problem. Just waking up is the issue. It's not something I really, I'm thrilled about. So, like, I can't think about, like, getting up and, like, starting to, like, run around or anything. Like, it takes me a while to, like, actually get there. To not even just, like, to feel physically okay, but, like, just I have to find that motivation and, right as I wake up, it's too much, usually.
Yeah, and I think it's different for based on when you get the most energy to, because some people are they don't have as much energy in the morning to get in exercise, and some people are better off in the evening.
Yeah, no, that's me. I'm definitely more active as the day goes on. I'm more energetic.
And clearly, I'm early morning.
Yeah.
Don't look at me at 3 o'clock. It's a whole different story.
Oh no, that's when like everything's just getting started for me.
Yeah, but it is great to see, and I know everyone is. I was talking about the showers last night. There was this downpour, and you keep on asking yourself, hold on. It's March. Yeah. Where are you coming from? And I think our forecaster alluded to some more rain coming, but it's the weather. They say it's unpredictable, so maybe it'll change between now and Easter break.
Yeah, I know that's what everybody's hoping for. I know I am.
Yeah, well, either way, it's going to be a welcome break for many people.
No, yeah, for sure. And I think that it's going to be a bit different. I mean, what was funny is that I've been talking to people and I was trying to remember what last year's Easter was like.
We were on lockdown.
Yeah, and I think at that point we couldn't leave on Sundays and everything still. So it was still like a pretty, heavy, it was a pretty heavy lockdown. And I was asking for that, and for that reason was why I was asking around, because I felt like it was like a blur for me. Like everything in and around that time just sort of blended into one sort of extended, thing where every day was almost the same.
Yeah. I think, I thought about last Easter, but this Easter, I just think it's going to be such an interesting time. We've gotten reports that, Placentia is booked out, Hopkins booked out, Kikaker's booked out. Belizeans are going to be moving across the country. Yeah. And I think I've met some people who say, oh, I went to Hopkins. I've never been there before. And so here is this opportunity that came in the middle of such a complex time where Belizeans are taking it upon themselves to really explore and see new parts of the country and fall in love with it as well.
Yeah, absolutely. And I think I definitely took advantage of the opportunities to do that, between last year and now. And I think that if we even think about this Easter and looking forward, it is encouraging at least to know that, people that things could go back to normal and that people are still wanting to do things like that. And it certainly is good news for our tourism sector, people getting business. Of course, everybody always has the concern in the back of their mind, or in the front of their mind, really, I shouldn't say the back, about the pandemic and all the issues related to that. I think the vaccines are starting to change things, both internally and internationally in terms of everything, but travel as well. But all of the precautions in mind, hotels, doing what they can, or tour facilities or restaurants, trying to ensure that everybody can, one, follow, what it is in the law, but also just in general to keep people safe.
Yeah.
I think that's an interesting thing to navigate and look at looking forward as well.
Well, I do hope that it is on the front of everyone's mind, because I know part of being able to get to these very popular destinations in the country that we know are booked out with mostly 90% Belizeans, it is important that we also practice those. So when you're queuing up to go on the boat, they have a capacity limit. When you are going on the road, especially if you're heading down south, that you're going to be very safe. So it is a time to still remember all the threats that are out there, but still just give yourself a little breathing room as well.
Exactly.
All right. But we, yesterday in the news, there was a really interesting story. I wanted to hear your thoughts on it. So there was a video that was circulating on social media. We know that there's a lot of attention in the United States looking at unaccompanied minors making their way into the United States. And it started at the end of last year and continues into this year. What's interesting about this video is that the journalist was kind of stopped some kids, and there you go, you hear a little girl speaking English, and lo and behold, she's from Belize.
Yep. No. Yeah.
So let's check it out for a moment. Go.
And you speak English very well.
Yes, Mom.
Where are you
Sir,
from?
I'm Belize.
But have you been in the United States before? Never? You learned it there?
No, I'm Belizean. I actually learned English from Belize.
Well, that's good. ¿Y cuántos años tienes tú? 12.
12 years old, 12, 14, 9.
¿Y sus padres dónde están?
My father is in Houston, Texas. Venimos solos.
¿Y ustedes solos? ¿Tus padres dónde están? ¿En México todavía?
Perdón, Honduras.
Honduras. Ya ibas a decir Estados Unidos, ¿verdad?
My father is at the United States. My mother is at Belize.
Ok. ¿Y a dónde van ahorita? ¿Se van a entregar?
Yes, we got a thing.
¿Y usted cuántos años tiene?
17.
¿De dónde es usted?
De Honduras.
¿De Honduras? ¿Vienes con ellos o no?
No.
17 años.
Sí.
¿Tu familia dónde están?
En Honduras.
En Honduras. ¿Con cuántos viniste? ¿Ustedes solos?
We are all by ourselves.
All by yourself.
We just meet each other over here and we actually started to talk.
Ok. Pues ahorita vienen los patrulleros, ahí están. Te van a decir a dónde entregarse, ¿ok?
Yeah, other people we met over there, she told us to go where.
To go that way. Entonces ya saben.
Yes, sir.
Ya saben dónde ir.
Sí.
Ok, mucho cuidado.
Yeah.
Gracias.
Yeah, of course, if you've been paying attention to international news, especially that coming out of the States, immigration, particularly immigration from countries south of the United States, Mexico and Central America, even as far as down South America, it's been a very, I'll say it's been a very big issue politically in the States over the past few years, especially since, well, it was, we all kind of remember, Trump and his rhetoric about immigration.
Yeah.
And
the wall.
yeah, and of course, it's recognizing that we recognize that there's an issue, but of course, one of the significant things that was a part of that whole discussion, especially for the last few years, was what is the status of children going through that experience, because we know that there were reports of the family separation policy, and even children, like in this case, coming unaccompanied to whether it is to cross the borders illegally, whether it's to seek asylum, whether it's to access access the United States through on one of those humanitarian grounds like that. But it's an extremely concerning situation to know that children are taking this type of a journey by themselves, because if you've ever watched or read any reports about what the journey is like to cross the US-Mexico border illegally, it's a very harrowing a very dangerous journey, not only for the physical elements, but also because of all the criminal elements that could be around. The terrain is very risky for the most part. Most of the miles, it's very desert. It's lots of desert. So to think that, just children in general, and of course it takes it home to think of a Belizean child having to go through that makes it all, brings it all the more home for us. Yeah. But it's, I think when I watched the video, I had all of those concerns and stuff were going through my mind as well.
Yeah, quite a few observations. For me, my first was, what an intelligent girl. Mm-hmm. She speaks so well. She was able to communicate. She was automatically translating for the other children there. Able to articulate, why she's going, how she's going, and kind of the directions that she's given. Clearly very bright. So that was my first thing. Here's a Belizean girl that's trying to get into the United States and it clearly has so much potential. Mm-hmm. The second part was really just how.
Yeah.
And I think that's the one that's really gut-wrenching for me, as you pointed out. And I think anybody who's really paid attention to what happens within the area where people cross the border, there are many dangers. And it's dangerous even for people who are traveling with adults, and I could imagine only more dangerous when it's an unaccompanied child. So what happened to even get that far
that's what I was
on
thinking.
her own, and how is this possible? Mm-hmm. I think that's the main thing. I understand that authorities in Belize are trying to locate the family, to understand how this happened in the first place. Why is this child moving across the border on her own? Because she clearly says, we were on our own, and we just kind of met up and started going together. So that was the second one and really, the one that still sticks with me now. And the other part is also, understanding the process of trying to get into a country legally, and where the majority of children and families that have crossed into the United States are seeking asylum or refugee status. I'm not quite sure, a Belizean would fit within these categories. When you think of people who are refugees or people who apply to be refugees or seek asylum, they're running away from something. It's no longer safe for them to be in their country, so they're coming to your country to find some safety. And that's how oftentimes people are allowed to stay, even though they've entered illegally. And I don't know if it's not like Honduras, where there's a very serious, or El Salvador, where there's a lot of crime, there's violence to families in different neighborhoods. So I don't know how that would work out as well, but it is a very concerning situation. Captured the attention of all of Belize. Everybody was talking about it, and you can understand why.
Yeah, and I think that I think it also puts things, or it's sort of a reminder, I think, that, if you watch international news, you hear about things like, the migrant, I think sometimes they call it the migrant crisis, or when you see things about the caravans and stuff, you have to once again, I think, recall that doesn't necessarily that doesn't exclude Belize and Belizeans, because on the one hand, a lot, Belizeans are clearly a part of this process, and we have, just because of our, not only because, but because of our physical location, we're on the route. So, human trafficking and people even just trying to come through Belize, going through our borders, through all different kinds of ways in order to get to the States, we're a very big, it's a very big issue for us. And we don't often see the end results, like in a situation like this, but it remains significantly both, for people from other parts of Central America who may be coming through here, but also some of our own, some born Belizeans as well go through this process. And it's very unfortunate and it's very scary, but it's a reality that I think we can't ignore, especially when we see, the face of like a young child, going through that. Hopefully, I mean, it's it's an ongoing situation that you know, you have to address from so many different ways.
Yeah.
So it's such a
It's
complex,
a very complex issue. Because even if they do make it, I mean, with all hopes, we want these children to get across safely. And this is an everyday thing. I think I saw a report where it's like double the number of unaccompanied minors this year versus 2019. And a lot of it, some people tie it to the change in government in the United States, where you had a very strict build a wall. People just assume that it's going to be easier, but there still is a process in place. But even if they make it across, you know, the situation at the border is one where it's still not known the conditions, it's still not known how long they're kept there, or what happens when their status is defined. So it's a pretty long journey, and it is heartbreaking when you think of children just kind of wandering out on their own.
Yeah.
So that was one definitely that captured our attention there. But we got to get moving into our show. Let's lift things up a bit with some motivation, and that means it's time for Eye Opener. And our Eye Opener, taken from dailyom.com, goes like this. Tears are as natural to us as breathing, and there is beauty in allowing yourself to be open to the pain of tears. How wonderful it feels to give in and let tears flow when we are overwhelmed with emotions, whether we are happy or sad. Tears come from the soul, from our well of feelings rising from deep down. When we give in to the prickling behind our eyes and the lump in our throat to let teardrops fall from our eyes, we allow our feelings to surface so they can be set free. Shedding tears can sometimes make us feel better, although it can feel like the tears will never end once the floodgates are open. There is no shame in letting tears flow freely and frequently. Tears are as natural to us as breathing. There is beauty in allowing yourself to be vulnerable enough to shed tears. Open up, release your tears, and let your feelings flow.
You know, that's a really nice eye-opener, and I agree with it 100%. But you know, honestly, I'm not really much of a crier at all for sad things, at least. So,
yeah, well, you see, I was going to say it's going to be different for you in general, because as men, you are socialized not to cry.
No, yeah, absolutely, that's true.
And that's,
I think
a bigger problem to dive into than we have time to.
I know, yeah, that's what I was going to say. I was going to say that for sure that's a thing, you know, and we've spoken about it in the context of different eye-openers before, and I think that everybody sort of has had, or we're opening up to more conversations like this, where we recognize the problems that arise from the way that, you know, men or male, you know, are socialized, particularly from when they're young age of children. And I mean, I can even remember certain things, you know, like on this, you know, when I was at school and stuff like that, basically where, you know, men are taught to suppress or hide their emotions, and especially when it's something that can be seen or interpreted as weak or vulnerable. You know, we're really taught not to do that, and of course it creates a whole lot of problems later on when we can't really deal with or face emotions. And it's especially sad when, you know, when you can't deal with it, and the way how it does happen when you do like act out or lash out, you know, sometimes, many times actually, in violent ways. Or, you know, there's other consequences related with just sort of, you know, keeping things in, and it's a huge problem. I think things are starting to change because people are recognizing the problems that it can cause, and also because, you know, since I think, you know, the achievements, I think, that feminism has also brought, whereas when we, you know, if we treat the sexes as more equal, and we recognize each other's, you know, the others' experiences, then and recognize that there's nothing wrong with, you know, expressing your emotions, then of course it leads to things. It'll you know, make the problem better.
Yeah, yeah, no, You know, I think that the eye opener talks about the release that comes from tears, and I think the problem, the challenge that we have very often is seeing crying as something that's weak, and it goes for both sexes. But at the end of the day, we're all humans with a wide range of emotions, and we have a natural reaction to what happens when we become overwhelmed with these emotions, and that release comes from crying. We're far way away from understanding that this is a healthy thing for us to do. And we cry when we're happy, we cry when we're sad, we cry when we're overwhelmed, we cry when we're frustrated or angry. And we do this, our body instinctively does it because we need it. It's like how you sweat when you're hot. Your body does it because it's necessary. But we are definitely far away from it. And I think the eye-opener, like what we saw today, because while, yes, it may be more acceptable, it's not necessarily accepted for women to be openly crying as well.
No, because then that's also like a point of like criticism, right? There's like where you're too emotional, and you know, therefore.
It's like, no, we all have emotions. We all have the same range. You know, you get angry, I get angry. You get sad, I get sad. It's
a drama queen. That's what people say. But you know, I was gonna say, like, just starting off, like, I generally am not that much of a crier, you know, for sad things or like or frustration. But if, you know, for like for happy moments, like in movies, yeah, absolutely, I do. And I'm not ashamed to say it. Like,
he cries in movies.
Yeah.
So do I.
Lion King. I was thinking Lion King.
All right, we got to get moving into our weather for today. And we're just going to go ahead and read the prepared forecast. So the general situation is for mainly fair conditions to prevail.
And for our 24-hour forecast, we're expecting sunny skies today with a few cloudy spells. And tonight we are going to see skies being partly cloudy, and shower activity will be generally isolated.
All right. Our winds are moving from the east at 10 to 20 knots, and the sea state is light choppy.
And our high temperatures for today, we can expect 88 along the coast, 94 inland, and 78 up in the hills. For tonight, we are going to see lows of 76 along the coast, 70 inland, and 66 up in the hills.
All right. The outlook. Wednesday and Wednesday night is for fair weather to continue, and shower activity will be generally isolated except for the south, where a few more showers can be expected. And we want to thank our forecaster, Catherine Cumberbatch, for putting that together for us. And now we're going to get moving into our show for today. Yesterday, we had an extensive conversation talking with the Minister of Education and his CEO. And we talked about what is being recommended as the phased return to the classrooms. We are at that point where it's being considered and implemented. And today, we're going to get the perspective of teachers and principals. So we're going to find out from various schools across the country just what it will look like for them, how prepared they are, and how they're making that decision.
And for our second conversation, we are going to be speaking with representatives from Social Security, and they're going to be talking all about a new online service that they're offering. So we're going to get all the details about that in our second conversation.
All right. And to close off for today, we have spoken a lot about people who may be traveling for the Easter break, but we know the realities in the country, and not everyone has the money to be able to move with the family at this time. And so when you're at home for Easter, we really do encourage you to be able to take the time and do some extra activities. So we have someone who's going to come in and talk about how you can have fun over your Easter break with the entire family. We'll talk about a list of activities that you can try to do just so you can spruce up your Easter at home.
Yeah.
So.
Yep, but with that, we are going to be taking a break before our first conversation. But before we do that, we do have one birthday shout out to give for this morning. So from all of us here at Open Your Eyes and Channel 5, we want to wish a very happy birthday to Leroy Samuels. And Leroy, we hope that you have a great day, and we wish you many more. Yep. But, of course, with that, we are going to be taking our first break, and when we come back, we're going to be hearing from teachers and principals on whether or not they're ready for schools to reopen. So please stay tuned, and we'll be right back.
It's a fact that you can access unlimited services with Smart. Tired of being measured or cut off when you need to be connected? It's a fact that when you sign up for Smart's Plus plan, you get unlimited talk, text, and unlimited data. And it's a fact that you can sign up with your group of up to 5 members for Smart's Share plans and up to 40 members for Smart's Enterprise plans for unlimited talk, text, and data. Smart has the true unlimited plans. That's a fact. Be smart and live smart.
In these challenging times, the one thing that is certain is that the Belize Bank Limited is here for you. There is nothing more important than your health and safety, and we continue to make every effort to make banking safer for you. Our staff is working around the clock to make sure you can do your banking conveniently 24/7 using our mobile banking app and online banking and keeping ATMs up and running. We value your relationship with us and are here to provide the support you need. First responders are also out there 24/7. Thank you, healthcare workers, security forces, firefighters, caregivers. You are all appreciated. Stay safe. We will get through this together. The Belize Bank, our country, your bank.
Pelican, the beer of Belize.
Hola, Tony.
Hey, Kevin, ¿qué onda? ¿Qué pasa?
Nada, le vine a buscar porque necesito comprar más mercancías de vasos y platos desechables para mi tienda de comestible. Me estoy quedando sin esas cosas.
No, hombre, fíjate que desde el 15 de abril no puedo importar nada de eso. Y se me acaba de terminar todo lo que tenía hace como 3 semanas.
Oye, pero nunca has estado sin esas cosas. ¿Qué está pasando?
Mira esto. Esta es la nueva ley que prohíbe todo el uso de plásticos no reutilizables. Esos son vasos, platos, cucharas, tenedores, todo eso. Desde 15 de abril de este año no he podido importar nada de eso. A partir del 15 de enero del 2021 nadie puede fabricarlo. 15 de abril 2021 nadie lo puede vender. Y a partir del 14 de julio del 2021 si alguien te agarra con eso, te multan.
Híjole, no sabía eso. Necesito cambiar algunas cosas. Les diré a mis clientes por qué esas cosas ya no están disponibles. Gracias, Antonio.
Así es, cuídate, man.
Passengers traveling to the U.S. must present a negative COVID test or a documentation of having recovered from COVID-19 to travel to the U.S. In light of this, Maya, in partnership with Caring Hands Clinic, have established testing centers in all their municipal airports. Caring Hands Antigen Test Center is operational in San Pedro, Belize City, Dangriga, Placencia, and Hopkins. These testing facilities are staffed by licensed healthcare professionals, including doctors, registered nurses, and nurse practitioners. Testing is done using Abbott rapid test devices that are FDA approved and made in the USA. The service is safe, fast, affordable, and the close proximity of the centers makes them convenient. Walk-ins are welcomed, but appointments are encouraged. If you would like to make an appointment, please feel free to do so at Make your appointment, get tested, and in 15 minutes, you can get back to your vacation.
Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back. And if you're joining us now, we're just getting our first conversation for this morning started. And we are continuing with the conversation on the topic of the reopening of schools. Yesterday, of course, if you were watching us, we had an extended conversation with the Minister of Education, the Honorable Francis Fonseca, talking about the ministry's plan for the phased reopening of schools. But this morning, we are going to be hearing directly from some of the educators on whether or not they're ready, how they're feeling about the idea of schools reopening while we're still in the midst of this pandemic. And joining us for this conversation, we have Rocio Carballo, who is the principal of Sacred Heart College. We also have Mr. Angel Leiva, who is the principal of Bishop Martin High School. And we also have Ms. Danica Garnett Humes, who is a teacher from Zion Park Methodist Primary School. Good morning, everyone.
Good morning.
Good morning.
And thank you for joining us. This is, of course, a very important conversation. Now, I think the first thing, before we get into, how prepared everyone is for the reopening of schools, I think let's check in and ask what things are like now, a little bit more than a year into the pandemic in Belize. What is the status of the schools now? How are how are lessons being taught, and how does what does it look like on the ground now for teachers? So let's start perhaps with Ms. Rocio.
Yes, a pleasant good morning, everyone. Blessings from the West. And definitely, I would like to share that at Sacred Heart College, we have been doing fully online. A lot of investment has been done, for our school to be able to go fully online. We have almost, I would say, 95 to 100% of our students who do have some form of device. Our population is over 900 students at Sacred Heart College, and we have a faculty of about 55 teachers. Mm-hmm. Presently, everything, like I said, is online. At the beginning, last year, what we had was something like a hybrid method, where we would have had some students, half of the population would have been at school and half of the population at home. But it would have been live classes taking place because the teacher would be teaching his or her entire class during that time, nevertheless. And because we did invest in tripod stands and everything to be done so that the students at home would be able to have access to the class happening at school also. When the closure happened, then it was fully online. So as a school, we were ready to go fully online. Presently, that is what we are doing. And we believe that at this point in time, our teachers have been far much more empowered with online teaching, and even our students. Everything, all activities have been conducted online, and I guess that has also empowered our students, our parents. We have even had our PTA meetings with over 800 parents logging in, be able to conduct our PTA meetings and having it with them as well. So as we can see, on COVID-19 has brought, yes, it brought some unprecedented and very challenging times for everyone, but it also empowered us to be more technology savvy when it comes to things that needs to be done. And I guess that all of us need to be grateful for that and look at the positive side of it also. If it wasn't for technology, our students also, some of them who had never had access to a device wouldn't have access to it at this point in time maybe as well. But as a result of that, now we are able to say that our students are definitely learning, and our teachers have done so much and continue to learn. And as a school, like I mentioned earlier, we continue to invest in programs, in app software for our teachers, for them to be able to continue to give the best learning activities to our students at home as well.
So you guys are all online, like it's live classes from school to child?
Yes.
Okay.
And there is something that we also did at Sacred Heart with our IT department. We work very close with our vice principals, our managers. And what we did was to merge 2-3 classes that a teacher would be teaching, so that that teacher would be teaching that particular class, since, you know, it was 3 hours, you know, that students would be online. So that was what was mandated by the ministry. So in order for us to have something like that and to cover most of our subjects for 40 minutes each, what we did was to merge some classes for a particular teacher. So the teacher would be teaching her entire 2 classes or even 3 classes. And that has been working for us at this point in time. It definitely has some challenges, but nevertheless, I think overall we are seeing the fruits of it also.
So let's shift to Danica. Danica, you are at primary level. How have you guys been doing school for the past year?
Well, we have been doing only packages.
Okay.
We have not done any online classes due to the fact that, well, you heard that I teach at Zion Park Methodist School, and it's a rural school, and many of our parents and the students, not many of them have access to the internet per se, because in some areas you don't even have, they can't even get signal. And so we do only packages. I am not happy that it was only that I could have done, because I know how to work with the online Google Classroom and, you know, the Dojo's and the other apps, but I cannot get the opportunity to do so due to the fact that it will be so unfair for the 1 or 2 parents who could get it. It will be good for the parents who could get it, but unfair for the majority who can't. And so we just stick to the packages. But it's very challenging with the packages, because what happened when we first started out, we used to give the parents the packages weekly. And we noticed that when it comes to the end of the week to receive these packages, only a few of them brought in the packages. And so we had to start doing it bi-weekly. And so we get more coming in than, you know, before. And so it's a challenge. And one thing I have noticed with it is that for the parents, some of the parents are doing the work for the child, which is so unfair. And then at the end of the day, we have to be putting grades in place or doing those kind of things. And it is not a true reflection of what the child is doing. And what gets to me the most is because I am the infant 1 and 2 teacher, because I am at a multi-grade school.
Okay.
And I am so unhappy about what some of my babies are learning now. Because like for my infant 1 babies, some of them are still not writing. I know that from a fact because of the packages that I have received. And then to be giving grades to these babies or giving them by putting them on grade scale per se, it is so unfair for them, you know. So I am one of those teachers who are ready to get back into my classroom ASAP.
And that's, I appreciate the perspective that you shared, because I think that it's important that we know, especially the online technology, it was a matter, and I've heard it from other schools, of trying to decide if we can't reach all, then we have to do something else. And it seems that's what you settled on there at Zion. Let's move now to Orange Walk, to Bishop Martin.
Well, good morning, everybody.
Good morning.
Well, Mrs. Carballo put it well. I will repeat a lot of the things she said. We did go online. The composition, the demographics of our school population is that we have about 70% who live basically in the town, because we have 2 villages that are bordering with the town, so we consider them urban as well, Trial Farm Village and Palmar Village. And so the students have access, electricity, internet access. And what we did is that we ensured first that everybody had access, that they had a device. At first, we were asking if they had a tablet or a laptop. A laptop would be the preferred choice, but unfortunately, that's not the reality. And so once we knew that we would be going online, we realized that even the smartphones would work.
Yeah.
And once that started, the teachers basically had to do a 180-degree turn, because back in July, early August, we were preparing for the return of students to the classroom, having 50% of the population a day. And when the announcement was made that we would open until October 5th, going online, then that's when the frenzy to get skilled. Some of the teachers who were not really tech savvy went into panic mode, but you know what? The resilience of teachers came out, and that's when camaraderie among colleagues really showed up, and they helped each other. Myself, with extensive IT knowledge, I knew I got in there to assist, and like in our school, we had decided that we would adopt the Google Classroom, the G Suite for Education. And now that we're in second semester, it feels like it was such a long time ago that we were in that frenzy that the teachers, we laugh about it, is that everybody is skilled with the online modality for teaching. We ensured, we have been checking constantly with the students and parents by extension, because without the support of the parents, it wouldn't happen. Anybody who was struggling, whether it was a device, even before the government tablets came in, we were purchasing tablets to loan to students. We ensure that those who are having difficulty getting internet access, we work with the internet service provider, be them cable companies or Digi or Smart, to provide internet access. In an instance for a student living in a rural area, we even provided the solar panel so that they had electricity to charge their device.
Oh, wow. Okay. So quite a bit of innovation taking place all over. Now let's move into the meat of the matter. So we get an understanding of what you've been doing. Now there is the proposal to return to the classrooms in a phased approach. And I want to hear what your plans and reactions are at this point. And first of all, Rocio, I know Sacred Heart has already decided, you've told your parents that you will complete the year online. Tell us about that decision.
Yes, definitely. We met as administrators as soon as we had our meeting with the Ministry of Education, with senior management, and especially where the consideration was provided to us to be able to choose whether face-to-face, for April, for May, or to be able to complete this school year. And so I met with the entire admin team, which is actually 9 of us, and we looked at all the pros and the cons of everything. And then when that recommendation came, I sent it to the Board of Governors. And unanimously, we had 100% of our board members who supported the recommendation of admin, simply because they did realize that there is no replacement for face-to-face instruction. But nevertheless, they do feel that it is very premature at this point in time for us to be able to return to face-to-face.
Yeah. What was the reaction? Sorry.
Go ahead.
I was going to ask you, what was the reaction from your parents?
Well, I'll be honest with you. We sent it out, and I do have a WhatsApp group with my PTA parents. And a number of them, the first thing when they saw the ad that went out, a number of them said, wise decision coming from Sacred Heart.
Okay.
I know that a few might not be very happy, but I am hoping that they would also be supportive and cooperate with us, since we are looking at the best interest of the student, the teachers, the support staff, administrators, and the community at large. It's the safety of everyone. I must say that as an institution, we did put all the protocols that they had required in place at our school. We even have an isolation unit. We have a restricted area. We even hired a nurse to be at the school, to be able, for whatever would happen.
Yeah. Because these were things that were asked by the school to get ready for what would have been the reopening in last August. But my question is though, did you consider at any point reopening? I mean, is it because the system that you have is working that you're continuing this way?
Okay, the system, like I said, is presently working, yes. And we are also looking at presently with the vaccine that is being distributed. Not all our teachers, I guess not even 50% of our staff, has been vaccinated, and the support staff less. And then, having our students coming to the campus, we are looking at all of these things happening.
Is that by choice, or they haven't had access?
They have had access, yes. Everyone has the access, faculty. Okay. But nevertheless, some of our teachers are very resistant. But I am hoping, I don't know if it's fair. I don't know if it's not trusting. I cannot say at this point in time. But I am hoping that some of them will definitely change their mind, and they would be able to go and get their vaccine as soon as possible. Okay. Apart from that, we also had some of our teachers, a few of them, if you can recall, it was on breaking news. Some of our teachers got infected with COVID-19. Yeah. And those teachers are unable to receive the vaccine at this point in time because it should have at least 6 months after they infected the virus that they would be able also to receive the vaccine. Okay. So all these different things were taken into consideration, as well as the prematurity and the time that is left for our students, to make a transition back to face-to-face at this point in time. Mm-hmm. We believe that it is most appropriate, and it's a more proactive approach for us to finish the year online. We have been meeting with teachers, getting their input when it comes to adjustments in our academic policies. Yeah. And we meet with them, regularly to hear from them also. And then whatever they recommend, we we definitely submit that. I do submit that recommendation to the board.
Okay.
And the board has been very supportive in making those adjustments for our students.
Okay. So Angel, let's hear from you. What's the thought process at Bishop Martin?
Well, given that we're already at the Easter break, there's not much time. Our seniors will be with us for a month only. It doesn't make good sense for them to come back. And so we are more inclined into finishing the year online. One of the considerations that came up, but the decision hasn't been finalized, is that we, in terms of exams, if the decision is to have exams, because even that is being deliberated at the moment, then definitely we would want the students to be in the classroom to do exams, because that would lessen the chances for cheating. But the decision on that hasn't been taken yet.
How are you doing your consultations?
We have polled our students and parents, and the latest results are that 54% say no, they're not in favor of returning to the classes.
Wow.
31% are saying yes, and 15% are unsure. They're saying maybe.
Wow.
The big concern is the vaccination. Even from amongst our faculty, we don't think that having the teachers vaccinated is enough. It's not just that the students won't be vaccinated, because the worldwide statistics are showing that school-age persons, they're hardly affected by COVID-19, and even those who contract the disease recover. They don't suffer the severe symptoms of the disease. The big concern is that if students are coming to school, they will be the potential carriers of the virus, and so they will be the ones taking it back home. And the people who are most vulnerable and who would, for whom it can be fatal, are the adults at home. It could be parents, grandparents, aunts, uncles. And so it's not enough just to have the teachers vaccinated.
Okay.
We need to have the entire adult population in this country vaccinated. So I think we should wait. And another thing to consider, consider is that we're into Easter break, and even though the quarantine regulations are restricting the movement of people, we can see just in the last holiday that happened, people are moving around, people are going to bathing spots and so forth. So we might have a spike in COVID-19 infections after Easter. It will take up to 2 weeks later. So a return to the class April 12th, I think it's too soon. We need to wait and see. We know what happened after the elections, so these experiences are supposed to guide us. So we think it's premature to return to classes right now.
It's interesting. I was kind of zoning into your health concerns there, because we did a quick poll yesterday. People were saying that the main reason they don't want to go back to school, parents were saying, is because of the health concerns. So your poll that you've actually done with your student body and parents, 54% said no. So that's a majority right there. But your concerns are not just about teachers getting sick. You're concerned about the students passing it to each other or taking it home to adults who may be unvaccinated.
That's right.
Now, at what point how do you make this decision moving forward? So you have 54% that say no, but there's still about half that are open or considering. Open or in support, I should say. So how do you make the decision moving forward?
Well, we will definitely return to the classroom. We can't stay at home the entire time. But we recommend that we prepare for the return to the classrooms for the next school year. By the time, if the rate of infection is low, the way it is right now, that you might have 1, 2 infections a day, then it will be wise to return to the classrooms, given that we have all the measures in place for students to maintain their physical distance, to be wearing the face mask, the sanitizing and disinfecting measures that we have, the sensitization to the reality of what it will be for the return to the classroom. All of those things will be in place.
Danica, earlier you had said that you were ready to go back into the classroom ASAP. Now, what is the feeling that you get from your fellow teachers, and perhaps any feedback that you might know from parents in the community, and what, or if any concerns are there that you or anybody else that you've heard from have at this time?
Well, I will speak for my school. What we have done a survey where we collaborated with our parents, management, and so on. And we, through the collaboration and doing our little survey and so on, many of our parents had agreed so far for their child to go back into the classroom. And I don't think that they're thinking of, how this virus will spread or anything like that. But I think that they're thinking, many of them are frustrated because many of them can't help their child. Some of them in the home, they don't have that extra help at home for their children. And this is coming from the primary school level. What I have done, even though they have said that we are not supposed to have students coming to our homes and things like that, I had my babies who were struggling. I live here in Mascal. I teach in Santana Village. And I told 2 of my parents, I said, well, if you're having this issue, I said, let them come to my home. I said, if I have to be used as an example for not doing what the ministry is saying on the TV and so on, I said, but the child needs help and it will only get worse. And so from doing our little survey, the majority of the parents, because what happened, we have the school bus that we have to use.
Yes.
And because it's all the little villages, we have Corsalita, we have students from Mascal, we have students from Santana, we have students from Lucky Strike and St. Anne's. And what happened is, we have a school bus that takes them to school, so we had to put in a survey whereby if the government does not provide the bus for the phase-in, will they find a way to get their child to and from school? And even that, the majority of the parents said, yes, they will find a way to get their child to and from school. And we even asked about the feeding, their lunch. And they said, yes, we will find a way to get them, to let them have their lunch to be at school. So a lot of them is through frustration because they're not reaching their child the way they're supposed to reach them.
Yeah.
And the reason why I said that I am ready, remember now I am at the foundation.
Yeah.
And the minute these students lose that foundation, that is it. Because not all teachers will push for these students to be at a certain level, right? Some of us as teachers know to get frustrated when we get children into our class who are not performing the way they're supposed to be performing.
Yeah.
And many of us don't want to take that extra mile to do an intervention or so to get that children from point A to point B. And right now, as I am presently speaking, we will be in that position. We will have to be putting intervention in place to get these children from point A to point B. Because as speaking, I don't know, I am wondering what the high schools will get for some of these first farmers.
Yeah. Well, because, I want to touch on that. I want to touch on that before we wrap up the show. But before that, Danica, let me just find out, how ready is your school for the return to face-to-face? And the plan, I believe, back in August was either a shift schedule, of some sort. Yeah.
Well, what happened is, our school is a small school.
Okay.
So if they said 17 can hold in the classroom, our 17 will be in the classroom.
Okay.
But we decided that we will do the staggering where we will have Monday, Wednesday, Friday, we'll have one set of students so that we can just have solo class because we are a multi-grade school. So we decided to go that way if we should reopen on the 12th or May, because then at some point we need to reach to these students. Especially I know two of my infant one student because I know their parents, but I have not had that connection like that face to face with any of them. I have not had the chance of meeting them, and you know it's not an easy task dealing with infant one students, especially when some of them enter into the classroom for the first time. But from the previous government where we had to put things in place, our school was ready.
Okay. So you're aiming for April?
Yes, ma'am.
Okay. So we're quickly running out of time, so I want to just get some of the reactions from you guys. What's your concern when the children do, let's say, you know, it's September or April or May. You feel safe enough to bring your children back to school. They've been out of the classroom. No one has had this experience ever. What's your concern for when the children come back in? Start with you, Danica.
Well, my major concern is keeping them apart. Because dealing with primary school children is not an easy task. And remember now, they have been out of school for over an year. And so a lot of classroom management will have to be in place, all right? A lot of them will come back with certain behaviors. We will have to try to, you know, and we will just have to continue be modeling what they're supposed to do, make sure that they social distance, because we do not know how long we will be in this situation.
Yeah.
All right?
Classroom
Because
management,
everything could be going down now, but come next, after the Easter break, like Mr. Liva had said, maybe things could boost up, who knows?
Yeah. And what about from the secondary level? What are your thoughts about when the children do come back to school? I think one of the things Danica mentioned was classroom management. What do you expect?
I can speak for Sacred Heart, and I guess it applies to most of our schools. I am presently looking at sanitization that will need to happen if, you know, when students come in and then another group is to come into the classroom. Sanitization must happen regularly, daily, and definitely that involves expenses also because of the equipment and everything that has to be done, and also the maintenance people to be doing that.
That's so true. So you mean between the groups, who's going to wipe down and clean everything?
Right. Exactly. Someone has to be doing, you know, there has to be sanitization in the classrooms, you know, on a daily basis. That is one of the things that also was recommended, you know, from before, especially with COVID, because we don't know who is coming, you know, and then all the classrooms will be used, but it would only be half of the students in each one of the classes. So basically that, I guess sanitization is a key thing, and also the washing of hands. Also the wardens. As a school, you know, many of us might have maybe one warden, two wardens, to be able, especially during breaks, you know, if we will be able to manage that at this point in time, more than likely it would be like what we had discussed before. Have the students bring their snacks and remain in the classroom rather than being out, but then it is also confining them to a room. And this additional supervision that has to happen not only on the part of maintenance, but most importantly on the part of our teachers also. So I guess it is a challenge. There are a lot of challenges that, yes, we will need to adjust. And I guess this is the time for us to start to make that plan for the new school year, to be able to have all these things even far more better for our students and our faculty and staff.
And from your end?
Remember too, it was also stated that the students should not be cleaning. So it will be solely on the teachers and maybe the maintenance personnel at the different schools.
And most likely it'll be the teachers, because even if you have one maintenance person, they can't wipe down all the desks in all the classrooms. From your end, Mr. Leva?
Well, I definitely see that we have to establish a new culture, a new culture of the way we behave. We have to instill a high level of responsibility for all. Students, in our case, the young people, these teenagers, they will tend to want to socialize. And we see it already in our communities where once people are familiar with each other, then the boundaries get fuzzy. And so even though you're supposed to maintain your distance, you see people still reaching out and bumping fists and elbows, and people who know each other, they still hug. Just yesterday, somebody who came to see me wanted to shake my hand, and I stepped back.
You have to remind them we're still in a pandemic.
Yes, so we have to, I think that will be the major challenge, to instill that culture at the beginning of how we're supposed to behave. We have to model that. We have to really monitor it and instill it, because more instill that culture rather than be monitoring, because it will be hard. We don't have the personnel to be looking after all of the students. We want them to behave the right way without being seen, because the teachers, they can be all over the place, and we don't have auxiliary staff who will be around. Our school doesn't even have wardens to begin with. So the big challenge will be for students to learn a new culture of what the expected behavior is in school, so that we mitigate the spread of this disease. Hopefully, we'll be able to maintain the rate of infection to very close to zero, so that there isn't a high risk when the students are at school.
And I can't miss the opportunity to be able to ask this one final question, since we've been trying to get everybody's perspective. I'll start with you, Mr. Leva, who actually was my high school math teacher. The ongoing negotiations about the salary cut and increment freeze, what's your perspective there?
Well,
you've done the math, I'm sure.
Well, nobody wants a salary cut, definitely. The salaries of teachers and public officers, for the most part, people have their monies budgeted, and it will affect significantly. And as has been said before, if money isn't circulating, the economy will get into a worse state. And so shrinking the economy even further by not having money moving around is going to affect.
All right. Rocio?
Yes, I definitely concur with Mr. Leva, and I would also like to share that presently I think that one of the key things that is happening is that all our income is, to a large extent, is remaining in Belize. I visited a doctor recently. I'm just using this as an example. And the doctor said, before COVID, he said, this is how it was at the hospital. But presently, because our people need to come to our hospitals now, and they really, many of them don't want to go out, to visit doctors in Chetumal, Merida, or outside of Belize. So they are really full with a lot of clients and patients coming in. So I think that is something also that is good for us, the economy, where the income is remaining in Belize. And I am pretty sure that as teachers, it's, that cut, as we are calling it, would definitely be very detrimental to many of us, because we do have budgeted our salaries, and many of us have our salaries committed already. I'm pretty sure that we can try to find other measures, and even maybe if it is a lower amount that is being looked at, it's something that can definitely be considered, but definitely I don't think not at 10% at this point in time. It will really, really be a drastic challenge for too many families that are already unemployed in our community.
Yeah. And Danica, you and your teachers?
Well, I agreed with Mrs. Carballo and Mr. Liva. We already have, our monies are already budgeted, and for us to receive this pay cut, many people are saying that as teachers we are selfish, but we do not have as much benefits as some of them out there. And we are the ones who spend our money with our students within our classrooms, because whenever our students come to us and they don't have something to eat, we make sure that they get something to eat. If they come to school without materials, we make sure that we go into our pocket and we give them those materials. And so this 10% cut, and then with this phase-in too, at present, they're saying that if the students don't have X, Y, and Z, they can come to school. Who will be the ones to be help providing for them? It will be the same teachers again. So I am not saying that something doesn't need to be put in place, but at the same time, I think the 10% is too much. That is the only thing some of us may take home after paying all our bills that we have to be paying out there until we get a pay again. We get pay once a month. It's not like we have pay 2 times for the month. And so it is kind of unfair in our, well, presently for many of us right now, and the teachers are fighting, but that is where I stand. I cannot take a 10% pay cut.
All right. Well, I appreciate your...
I'd like to add, if I may add, that
yes,
our teachers have been working harder, this year, having to adjust to the online modality, or even the teachers who are preparing packages. They have been working. So the claim by people who don't know what the experiences of teaching for this pandemic year has been, I think it's ignorance when they say that the teachers haven't been working, because the teachers have been working even more.
Harder.
That's
and
right.
Also to add to that, as he said about preparing the packages, I look at my granddaughter who is at a different primary school. The work is sent to her through the Google Classroom, and she has to write every worksheet from that Google Classroom. Now we have to send out our booklets. When the parents didn't send in their materials, we asked for it. Not many of them provided us with at least with the copy paper. Who had to get those copy papers? Sometimes we are taking our own copy papers. At one point, our local manager sponsored us with copy paper. So that is where we are, because the government is not helping us in those areas. The school has to provide, and a small school like us, it's very hard.
I really appreciate your honesty. I'd love to keep you all on longer, but we are out of time. And, it's important for us to hear the voices from across the country and from directly those who are being directly affected. So I appreciate you sharing where you are in making this decision and how you are moving forward with the eventual return to the classroom. Thank you very much.
You're welcome.
Thank you too. Welcome very much.
And with that, we are going to go ahead and take a break. And speaking about online school, we're talking about online services. Social Security Board is making it a lot easier for us to be able to access some of their services. They're going to tell us all the details about that after the break. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service. Working off-site doesn't mean you have to be off your game. Studies have shown that simply adding a keyboard and mouse to your laptop increases productivity by 26%. Add a monitor and you'll be 35% more productive. At Fulltech Systems, we have what you need to enhance your remote work or e-learning experience. With devices such as headsets, video conferencing monitors, webcams, keyboards, mice, docking stations, all with the brands you trust. Keep connected with collaboration tools like Microsoft 365 Suite and Kaspersky and perform efficiently no matter where you are. Full Tech Systems, your technology center, where you'll come for the price, but stay for the service.
As one of the largest cable and internet providers in Belize, CBC strives to provide our customers with the highest standards of quality, value, and service in all aspects of cable TV and internet. Monitoring our systems closely, our technicians combine creative planning and state-of-the-art technology with years of experience and training to develop and provide the most reliable and advanced cable and internet service to exceed your expectations. For CBC and our team of talented engineers, technicians, and customer service representatives, delivering less than the very best is never an option.
Win a backyard barbecue kit this Easter break with your purchase of a 6-pack of Bellikin beer, Bellikin Light, or Bellikin Stout. All you have to do is scan the QR code found on your 6-pack or visit bellikin.bz/win. Fill out the raffle form with your information and the unique 6-pack code, then submit. That's it. The more 6-pack you purchase, the better your chance to win. Drawing date is Tuesday, April 6, 2021. Have a happy and safe Easter break. Drink responsibly.
Currently, we're using Smart Elite VoIP calling plan. We use it interbranch, we use it to call outside, and we also use it to call international. It's far cheaper than what we used to have before. Our equipment, our new PBX box is new. So the PBX is very good because I can call to my Sartaneja branch, I can call to my Kikaka branch, I can call to San Pedro branch, and there's no cost using the PBS. Actually, right now, since we're in different locations, I can call main office from where I am at a no cost using the PBX system. I would recommend it, sure I would, especially the big enterprises who has a lot of employees. There's a lot of reduction in costs, 50% of saving. But that on a year, it's a lot of money that we're saving. Money that we could return to our members, since we give back dividend to our members.
Visit our showroom or call 670-6710 to find out how Smart's corporate plan and PBX systems can benefit your business. Consultation is free.
we're back, and if you're joining us right now, we're just getting into our second conversation for this morning, and we are shifting gears, and we're now talking to representatives from Social Security Belize, and they're going to be telling us all about their new online service. And joining us for this conversation, we have Chandra Cancino, who is the General Manager of Corporate Customer Relations Services with Social Security, as well as Arlene Neal, who is the General Manager of Service Management. Good morning.
Hi, good morning.
Good morning, Gavin. Good morning, Marlene. Good morning, Belize.
All right, and thank you for joining us for this conversation. This is a pretty exciting development. Now, why don't we just get right into it and talk, explain what the new My Social Security service is all about and how did it come about, really?
Okay, so I could probably start with that. And what as we had, we were mentioning earlier, the My Social Security, or the Peranza project, as we have dubbed it, because Peranza is the Garifuna word for hope, and that is the name we gave it back in 2017, 2018, I think it was, when the dream was born, and we decided that we were going to go with the online services for Social Security claims and benefits. Yeah. And so it started way back then. Of course, COVID was very helpful in slowing down and accelerating the process. Accelerating the process in that we were forced to move to online appointments because of the restrictions, social distancing, even the shutdown. Although Social Security never shut down, we restricted our services to appointments only, etc. So yes, but it slowed it down in that we were supposed to launch our phase 1 from last year. But nevertheless, we're here today. We're very excited and very pleased to bring this service to our stakeholders, because we are doing this for you all. And so this is the launch of phase 1. We are launching in 4 phases. Well, the phase 0 was the pre-launch phase, where we were saying coming soon, expect your online services, and people were saying, well, when you reach, with the wait and wait. So finally it's here. This is phase 1 now. And this is the My Social Security portal and registration services that we are now offering, effective Monday, yesterday, March 29th. Going forward, we will then launch phases 2 and 3, which is the compliance or the contributions section of the online services, and then benefits. And so the process that we are launching today is for asking persons who are insured with Social Security or who have a Social Security number, as well as those who don't, to log on to the portal and sign up. What the portal is, I try to liken it to like your little Facebook page for social, between you and Social Security, where all of your information will eventually become available. At this time, there is nothing there. At this time, it will be only for card renewals and registration. In the next couple of months, we will then add your contributions. All of that data is being transferred. You will then be able to see your contribution history. And then going forward, you will then be able to claim for benefits. So then Ms. Neal has a little bit more information perhaps on the actual process of launching signing up for the My Social Security portal.
Okay, Arlene, tell us.
Hi, good morning, Marlene and Gavin. Good morning, Belize. So this My Social Security self-service portal, as we're seeing on the screen, is an online platform to allow our customers to create a portal account and commence the registration process online and visit the office to finish the process. Creating an account is a requirement for you to be able to, of course, access the online platform of the self-service portal. You follow the various fields. It's a pretty straightforward process, and it requires it facilitates 2 segments of customers: those who are already registered, which is our larger population. They would enter their information, an account would be created, and they would get an email with a reference code and a QR code that they would need to wait for a Social Security officer to be in contact with them for us to validate that that person indeed is who they say they are before we give them access to that Social Security registration account. If you already registered, you would have a Social Security number, and that is the account that we will give you access to. Thereafter, you would go on the online platform on the My Social Security self-service portal, and you're able to do an application for a replacement card. You're able to do an application to update your marital status or any other information. And for persons who are registering for the first time, they would create a portal account, but their account wouldn't need any validation because there's nothing to link that account to because they're just starting the process. And so their transition would be create an account and they proceed to enter their online application, get an appointment to visit the office, and once they come into the office, then we complete the process. So the customers are now able to enter their personal information once their portal account has been created, continue to do their transactions, all registration transactions online, and they're able to also request a link to any child or children registration account as well.
Okay. So this is, so you spoke of two areas. Somebody who already is registered with Social Security and somebody who wants to register for Social Security. And that's the first phase of the project. That's what you'll be able to do.
Yes. Okay. Persons who want to register for the first time, persons who already have a Social Security number and want to access that account online would be able to do so via the self-service portal. Currently, you still have to do through the appointment process on the portal, visit the office to take a picture, an electronic signature, and present your original source documents, your birth certificate, your passport, and whatever else that supports your identity based on your nationality as well.
Okay.
And I'm sure that, even though you went into the process just now, some of our viewers who are watching will be thinking, what are the major benefits that this new service provides as opposed to the old process?
Oh, the benefits of this is that, one, you have access to your registration information online. You start the process online for us where you enter your information. You visit the office in a more organized manner. We've been doing bookings for registration appointment since last March, given the COVID challenges, managing the crowd. This will enable us to also improve the service time that we offer to our customers in terms of long waiting in lines, and there's a crowd in the office, and so you're able to manage your time better.
Yeah. No, it's because, go ahead.
And later on, this is the first phase of the portal services. Later on, we have where you'll be able to access your contribution history. Everything that we have on record for you will be available to you in your portal account. And you'll be able to also access your benefit record. The platform that Chandra spoke about for later launch would include where you are able to also submit a benefit claim online.
I was going to get a bit more information on the renewal of the cards. Is it a simple online process, or does that also include a visit to the office?
All requests for new or renewal of a card ends in the office. You start the process online and you end it in the office, since we must take your picture, we must capture your electronic signature, we must, where necessary or required, your original documents such as your birth certificate, your passport, and any other support document that identifies you.
And when
Marlene, that's where the appointment system comes in, because also through the portal, during the process of whether it's a renewal or a new registration, you are required to make an appointment to do exactly what Arlene just said. To go into the office just to have the verification done. So it's not a case of going now to the office and being in a long line. waiting to get this done. You will have a definite day and a definite time where you will go into the office, and you should not be waiting in a long line. And so the process should be faster. We do have a little backlog of an online line where you get an early appointment.
Okay.
But on that and trying to see how we may be able to add on to the number of appointments that we're making, because we see that the uptake is very high, and persons don't want to wait too long for their renewals or for their registration. And so we are currently working on trying to add additional appointments to that service as well.
Well, because the Social Security card is such an important part of or identifying tools when we do a lot of different businesses, so we're always asked for it. My question has to do with just kind of this whole transition online. This started before COVID, and there's a lot that you've had to jam in the past year, from online sickness claims to a number of other things. How much has this helped in moving this process forward, that you're now at phase 1?
It has helped us a lot, simply because we were thrown into that online service life that what we have been planning for, but we never really knew the reality of. And now we are able to see simple things like, for example, submitting the sickness benefits. Persons, we are seeing that a lot of these claims we offer the online service, and we tell you can scan it or you can take a picture, but we notice that a lot of these claims that are being submitted are not clear. So, those are things that we are learning as we go along. So we are trying to improve on that, so that when we get to the point where we are launching the claims benefits process, these things we can address. So it's been a good, a good transition for us to be able to understand, the challenges, not only from the business side or from the back end, but also from the customer's perspective.
Yeah.
And the best way to access it, I mean, I know that it's on the website, but from the graphic that was just shown a little bit earlier, is this also something that you can access through your mobile device, right?
Yes, the process will end. Will end with a Social Security app, where you will be able to just, forgive me, download or upload it to your phone all the time.
Yeah.
But put it on your phone or your mobile device.
Yeah.
You will be able to access your services directly from there as well. That's towards the end of the phase.
Yeah.
The end of the plan.
And so this is, starting off with just kind of the application for cards or renewing your cards. I keep on hearing you say that's just phase 1. And I'd imagine while that's a very necessary service, it's probably not your most demanded service.
Surprisingly, we see from within, we see the registration process for Social Security as one of the most important processes, because that is where you become an insured person. That is where you enter into our world of Social Security, and then everything else follows thereafter. So in order to qualify for benefits, you have to register. In order to pay contributions or have contributions paid on your behalf, you have to register. So for us, and for a lot of persons, it's their lifeline for work. Persons who come to the country as, let's say, immigrant workers and have short-term work permits, they need a Social Security. They need to register. We use the word at Social Security register, but sometimes we want to clarify and add renewal, just so that persons know that it's not only registering for a new card, but also renewing an old card.
Yeah.
So it's important for us, but indeed, numbers-wise, certainly the benefits section, that we have a lot more, in the thousands of claims per day and per week that we have to manage. So importance, we see it as a very important process, but certainly when you look at numbers, claims would be certainly the highest, claims and benefits.
Yeah. And for people who are still not internet ready or internet friendly, you're still offering the service where they can go into the office?
Yes. We are still providing assisted services. You can still Well, we also launched our customer care center yesterday, Monday, right? Yesterday, yeah, the 29th. The same time we launched the online phase 1. And so we actually have a unit now dedicated solely to assisting customers, which we never had before. So that group of persons is managing all the customer channels, customer communication channels, which include telephone, which include messenger through our Facebook app, which includes, we now have a live chat on the website. So if you go to the website and you have a question or you want some clarification, you can chat with us instantly on the website. And during working hours, all of those channels are answered either instantaneously or within a few minutes, depending on the queue of questions that are coming in. So yes, we do provide services for persons who may not be technology savvy. They can still come in. Of course, we encourage them to make an appointment. We're still in the middle of a pandemic. We want to avoid crowding as much as possible. And so we ask that you use the appointment system if possible. You can get an appointment, call the office and they can help you to get an appointment through a phone call. And as well as the persons who may not be able to read or to write, we provide assisted services. So it is not mandatory at this time.
Okay. And since you keep on teasing us that there's more to come, what's the time element for the phases? So we're doing this portion now. When do you plan to roll out the addition of other services to be accessed through my own portal?
Arlene might have a little more insight into the timing of those.
Between now and later on this year, there will be several other services that will be rolled out as a part of the deployment of the full Peranza platform. Right after this, we move to services for the employers. We do have an online platform right now, but that will be integrated under the Peranza platform. And we continue to build based on our design plan. Where employers will then be able to use that platform to pay. We have where we will access, customers will be able to access their contribution platform. We have benefits upcoming, and I think Gavin had asked earlier, and we do have a series of different portal access that will be available. Right now, if you go on the portal site, you will see only insured persons, that is for our employees. But later on, you will see an employer section, you will see where you have medical provider section. So and Gavin had also asked about if we're only able to access the service right now online via the website. That is so, but it's on any device. And the app for the telephone and the mobile device will come later on.
Okay. Definitely, I think when we think of this particular time, one of the conversations that we're starting to have is how our reliance on technology may be something that has changed for good. Many people, I think, will not want to go back to some of the traditional ways of doing things since they've discovered the convenience of online. But when we talk about Social Security and we talk about private data, the biggest concern is security. So let's tackle that one. How secure, or what efforts have been put in place that whatever information is submitted is private, confidential, and safe?
Well, for the Peranza project, right? When we had these preliminary discussions all the way back to 2017 and 2018, that was one of the major concerns. Security of persons' information, and so from the moment we started to build, because this actually Peranza is a systems integration of all of our different or registration or benefits and our contributions. It is will all now be integrated into one. So certainly security was on the forefront of that discussion, and so it was included in the preparation for these online services. So the providers that are assisting us with building this technology have a very key role to play in ensuring that the information is secure. I'm not a technical person per se to be able to give you the technical details, and we have somebody who will be able to do that for you probably the next time we speak with you. But 100% sure I can tell you that security was at the top of the discussion and one of the #1 requirements of the providers that are in the process of helping us to build this technology.
Mm-hmm. And Arlene, from your end, what's been, I mean, it always is an adjustment when you roll out a new service. What's the feedback like so far?
Oh, the feedback has been great.
Yeah.
We've undertaken training for our staff. We know that it will take some time, like any change that you have to manage, you continue to monitor.
Yeah.
Since yesterday, we've had a number of activities happening on the page, on the portal. We've had persons sign up. It requires a validation process. If, like I said, if you already have a social security number, that we can validate who you are. So our staff is engaged to ensure that when the customer creates their portal account, we reach out to them to confirm and validate that they say they are who they say they are before we link that registration account. And so we expect that it will get very busy. As always, like Chandra said, registration is a full-time service that we offer, and it's continuous. So we're excited to see how this will roll out. We are reviewing, we continue to review the level of service that we provide, and we know that appointments are of high demand, especially in some of our bigger branches, like Belize City, Orange Walk, and Santa Elena. And so we're working very hard to see how else we can extend the service within the capacity of our resources as well, while not compromising the level of service.
Mm-hmm.
Yes, because yesterday we only launched the portal quietly because we still want to ensure that everything is working before we start the actual campaign for the uptake. And we had already in a couple of hours we already had over 100 people that had signed up for the portal. So I think people, especially the younger generation, are hungry for this sort of access to information, as opposed to having to come into an office and request your contribution history and wait 6 weeks and all of that. And so I think it is also important for the younger persons to start to engage with Social Security at a younger age. We tend to wait until we are sick or until we are going to retire to look at what we have contributed over the years, and sometimes it's too late, and we don't meet the requirements. And so I think this is also going to be helpful to engage those persons who may not think that Social Security is important now to keep engaged and make sure that they know what's going on with their Social Security account and contributions.
Can parents register their children through the portal?
Yes, that's a very good question, Marlene. Anybody who is 14 years or older can access the portal, create an account, and access their information. A parent right now is authorized to register their child or children under 14 years of age, and they are able to do that as well on the portal. The parent of a child between age 14 to age 18 can access that child's account on the portal. They can request a link, and they will be provided a link to also be engaged in that child's account up to age 18. Of course, we have to also verify and prove that you are indeed that parent of that child. And we have the situation where you have persons who are unable to act for themselves, and so they have a legal guardian.
Okay.
Once that legal document is provided to us, we also grant you access to that portal account for that individual that you're acting on behalf of.
Okay.
And well, ladies, we are just about out of time for this segment, but we certainly appreciate you coming in and telling us all about some of the features of this new service. And we, of course, encourage people to go out and access the service if they're able. So thank you.
Thank you all for having us. You're always very good hosts and always give us the opportunity to share new information and updates. We'll probably be coming back again for the next phase and a few other times to keep the public engaged and informed.
Definitely, and I'm sure by the next time people would have gone through the process and they'll have lots of questions for you then too. But we appreciate you keeping us in the loop and letting us know that this is taking place. One more service that we can at least initiate online and eliminate the process of going in and reducing the time it takes. So thank you and best of luck.
Thank you, guys.
Thank you.
All right. With that, we're going to go ahead and take a break. And when we come back, as we've said, a lot of families are not in a position to be able to travel this Easter, but that doesn't mean you can't have fun. We have some great ideas coming up after the break, so please stay tuned.
If we are only as strong as our families, businesses, institutions, and the communities that surround us, then by giving businesses the power to grow, entrepreneurs the ability to expand, and by giving our families the right to own something, the Belize Bank gives you the power to build a nation, our nation. Stronger together. The Belize Bank. Our country. Your bank.
Welcome to Mahogany Heights. My name is Raquel Vega. I am the community health worker for Mahogany Heights.
Located just off the Western Highway between Belize City and Belmopan is a small village known as Mahogany Heights. As the community health worker in Mahogany Heights, Raquel Vega cares for approximately 1,063 persons. She has lived in Mahogany Heights for 18 years and has been serving as the community health worker for 11 years.
My role basically is to educate our people first of all. And for us is to just offer basic first aid service to our community.
As the country is learning to cope with COVID-19, community-based delivery of essential health services becomes a viable solution to the disruption of health services created by an upsurge in cases and lockdowns and to the shifting of the health workforce.
Whenever they come at us, have to make sure they sanitize, we do social distance and try, to keep it safe.
Through the European Union-funded Health Sector Support Program Belize project, funds were reoriented for improving integrated healthcare at the community level during COVID-19. 230 health workers, including Raquel Vega, received work kits containing non-contact thermometers, stethoscopes, glucometers with strips and lancets, and first aid kits.
As a community health worker, I am now equipped to go out into my community and serve better in my community.
Thank you. Gracias. Sereme. Thank you.
set in place by the Center of Disease Control and Prevention. Passengers traveling to the U.S. must present a negative COVID test or a documentation of having recovered from COVID-19 to travel to the U.S. In light of this, Maya, in partnership with Caring Hands Clinic, have established testing centers in all their municipal airports. Caring Hands Antigen Test Center is operational in San Pedro, Belize City, Dangriga, Placencia, and Hopkins. These testing facilities are staffed by licensed healthcare professionals, including doctors, registered nurses, and nurse practitioners. Testing is done using Abbott rapid test devices that are FDA approved and made in the USA. The service is safe, fast, affordable, and the close proximity of the centers makes them convenient. Walk-ins are welcomed, but appointments are encouraged. If you would like to make an appointment, please feel free to do so at Make your appointment, get tested, and in 15 minutes, you can get back to your vacation.
We're getting our final conversation for this morning started, and we are going to be speaking all about ideas that you can practice at home over the upcoming Easter break that don't require you to spend a lot of money or travel very far from your house. Yep. And joining us for this discussion, we have Ann Palacio, who is an educator and an educational consultant who's been on our show before. How are you doing?
Hi, good morning, guys. Good morning, Marlene. Good morning, Gavin. I am feeling Easterly.
So are we.
Yeah. This is good. This is good.
Yeah. So apart from hoping that the rain doesn't come down this weekend.
And the cold front.
And,
Oh, yeah.
Yes, there's supposed to be a cold front too.
Yeah.
Yep. But even if that happens, we'll find a way to enjoy the Easter break, which is what we're here to talk about this morning, right?
Exactly. I'm glad to be here this morning, and because of what we're going through with COVID, of course, we're figuring out ways of how we can have a nice Easter and be at home. Some of the activities depend on the ages of your children. I have had some parents who are potentially going to be parents. And one of the things they had asked me, because I have seminars during all through COVID, I've had online seminars. Many parents are in such a panic of what's going on. One of them said, "Well, Miss, you're talking about children who are already here. How about children who are in the tummy?" And I said, "That's perfect. You could exercise with them, do your exercise, talk with them, play music with them, because kids love music in your tummy. They love it." So even those potential mothers to be have things to do too. And so, as I said, it depends on the ages of your children. You could start off, first of all, children love to color and they love to paint. And Easter is the perfect time for it because Easter is colorful. It's yellow, it's purple, it's green, it's all magical and like rainbow colors during Easter time. So get them to color, get them to paint, and get them to mess up, especially young ones. I know there are lots of parents who are saying, "Oh, they're going to be messy," and they're going to let the kids be kids. You know what I like about COVID? The only thing I like about COVID is that it brings the family together, whether you want it or want it not. It lets you become very tolerant, whether you want it or want it not.
Yeah.
And it let you be honest to yourself that you can't be restricted anymore. There's certain things like having fun with your children that I know many parents didn't even have time to because they were out working 8, 9, 10 hours a day. Most people live outside of the city. They didn't have time. By the time they get home, it's time to eat and sleep.
Yeah.
So COVID has allowed us to bring us together, and this is where Easter comes in. Perfect time. The phasing of school is going to be starting soon. So this is the perfect time for you to color with your kids, paint with your kids, and everything you do, please save it. What you can do is get adhesive, the clear adhesive tape, and then you could tape it right over all the work that you have done. Well, of course, after the paint has dried. And then put it either in your living room or in the child's bedroom, depending on where the child wanted to be, so you can have remembrance of what they're doing. Also, you can also think of Easter baskets that you can make together from simple things that you could find around your house. You can also find things like, for example, cooking. Some people, some kids love to cook from they're very young. They love to cook. Let them be a part of that. I wasn't a cooking girl, but let them be a part of that section for you. For example, whatever you cook, you can take that outside for the outside activities. So if you're making either icicles or popsicles, or you're making frozen cups, you're making pastries, those things can be taken outside because you have indoor and you have outdoor activities. Then you can have what we call camped in. You could actually throw some sheets on the ground with some blankets, with some pillows, and you can actually have you take off all the lights. If you're going to use candles, be careful with those, but I would prefer you use flashlights and have the flashlight stand up around you. And then it's like light glowing at night, and you could actually read together or watch some nice movies together, right?
Yeah.
And then you could also make some nice crafts. Crafts are always a bonding time for families, especially kids. You can have the eggs. You can make them. You can boil them, and you can color paint them, or you can actually have it's 25 cents for Bristol board. Get the Bristol board, cut out the eggs, you and your kids together, and you can actually paint them. And let them paint them how they want it to be painted.
Not how you think it should look.
Exactly. You know, because it's their time. It's their time.
Yeah.
So I think that's some of the things you can do indoors.
Okay.
Yep. You know, now, as we're talking, I think these are a bunch of great ideas. And, a lot of people watching are probably thinking, this COVID has also meant it's also been a difficult time financially for a lot of families. So, a lot of people are thinking budget. How am I gonna? Because a lot of people, are on any holiday really, whether it's Easter, whether it's Christmas, they always think like, how am I gonna buy something, or do I have to buy something new and fancy or something? We see these pretty Easter baskets in the supermarket and stuff, but what advice do you have for the parents who want to be budget conscious?
Well, first of all, I think it's a natural thing for us to think that we used to just go out and buy baskets or we order it. We have to recognize now that we have to look at what we're doing now with our money-wise, and you don't really have to buy anything. You could just be conservative and look at what you could afford. I mean, I've always been giving my kids baskets. Up to now, they're mostly all adults. And they're like, Mom, what are we going to give you for baskets? Well, what I do is give them broom and mop because it's about cleaning time. They're like, Mom, are you kidding me? It's like, no, I'm not. It's not about eggs anymore. It's about getting the place clean. So it depends on what you want for your budget, because then you can't afford to go buy $50, $75 worth of a basket now. That's ridiculous. But what you look at the small little things that you can look at the shops around you, the big grocery stores, and like I'm always looking at bottom dollar, some of the public store. There are some stores that you could look at that are on sale for different little goodies that you can put in those baskets. And then also we're looking at being healthy. The virus has taught us a lot about keeping healthy. So in those baskets, look for healthy things. Like part of the outside activities is gardening. I was never one for gardening. I don't do gardening. These fingernails shouldn't get dirty. But COVID has taught me, girl, you better humble yourself. You better go garden. And so all those things that you look at and you made in your garden, like sweet pepper, lime, all those things that you have grown together as a family, and you can start if you haven't, those things could be a part of your package too. And you don't have to go to the store and go buy it. You don't have to go to the market or anything. It's right there in your backyard. And you can put those in as a part of your package for your kids also. And then it's reusable because you can use them when you cook. So again, you're doing the bonding thing. And then of course, the swimming pool. Listen, COVID has taught me one thing. Go back to childhood, old school. You not got no blow pool, get your bath pan. Nothing wrong with that. Nobody no care right now what's going on. Fill it up. If you have the swimming pool that you can blow, that's fine, blow it up. But you have the bath pan that we had in the olden days, fill it up and you jump in there. With the swimming pool, the blow-up swimming pool, you have more time to play. You have to throw balls at each other, and it helps with your motor skills. It helps with your muscle skills when you're flopping around in the pool. It also helps with bonding time. All those things that you cooked inside, you can bring outside for the family to enjoy. And then again, it goes right back to old school. When last did you play hopscotch? When last did you play freeze catch? When last did you play run over? As a matter of fact, do some of you even know what those games are?
That is true.
When last did that's how we were brought up. Bike riding. If you have bikes, go ride with your kids. I mean, remember when you used to be on the wagon thing and they used to pull you? I remember that. They pull you all around the street. And if you're in a community where it's very safe, like for example, where we live, it's a dead-end street, so you can see when cars come in, so it'll be safe for your kids to be pulling along the street side, and it will be safe. Then, of course, the famous Easter egg hunting and scavenger hunt. You could even put that into a game where you can play by points. How many eggs you find, how many little beaties things you find, little sweets that you find around the house. And you could also use that educational because one, you're using going by points, so they're adding, and two, you're giving them clues, so they use their critical thinking skill to find where these eggs and these wherever you put around the house, and you could put them inside and outside. And then be fair, because if you have kids that are of different ages, you cannot put those words and those clues in a way where it's going to be difficult for one. Because a 5-year-old, you can't use the same thing for a 12-year-old. So you're going to have to make the clues very reasonable for those ages of children. And of course, again, COVID is all about loving and taking care of each other. Maybe those Easter baskets that you made with your kids, just in your neighborhood. You don't have to go far because, of course, of physical distancing, but you can put some of those together to give out to the people in your neighborhood, which is going to bring some type of love and camaraderie with those in your neighborhood.
And, I like also the idea that you brought up earlier about crafts, because we can also think about the idea of, again, going back to the idea of being budget conscious, repurposing sort of household items. Also, we think about common things that are around Easter time. A lot of kids are going to be making kites, and they just make those out of. Sometimes you can even use plastic bags and little sticks and stuff like that.
Yes, exactly, and that's what I'm always telling my parents, that you have to. Now is a time for us to be resilient, yes, but also we have to learn to be conservative. If you have never, because I'm not good with money, to be very honest, but COVID has taught me, girl, you better get with it again. So it also taught us that how we can budget, what we can do to budget, and not to go over our budget. Once we say this is what we're going to be doing for the month, this is what we'll be doing for the month. If we say, and many, because parents I have had a couple of seminars before this, with parents who are just, they're used to having their children going to resorts. Miss Annie, how am I going to explain to them? Show them the bills. Show them the bills. Those who are teachers, there were a couple of teachers who were in that seminar with me. I said, take out the 10% count. What do you get? Show it to them. Let them understand that it's not that you don't want to go, because my kids are used to going to resort. As a matter of fact, I'm used to flying out. But I have to realize now that I can't do those things that I used to do because of the stringent measures that we have to take now in this COVID situation.
I think that's such a key point, because a part of these activities, it's to ensure that you help the children cope with the disappointment, especially when you're accustomed to whether it's going to the Keys or doing day trips, or maybe you had fancy Easter vacations and mom and dad or just can't afford it. So talking to them and still ensuring that Easter is a fun time, even though it may be very different.
Exactly. And even you can do there are lots besides those, lots of fun things. You have these kids, the kids who have on Instagram, on Snapchat, on Twitch, all these different social media. What you can do is that be a part of it. Like my daughter was doing a video,
the TikTok
on
dances.
Instagram. Yes, and I started dancing with her, and she's like, "Mom," I was like, and then she was like, "Oh, Mom, this sounds good. This is good. Just have a little dance off. I grew up in the 60s, 70s. Okay, let's do these things in the what we did in the 70s. Let's go. Let's dance. And then you do what was happening in the 2000s, and let's do a dance off. I mean, these things are fun with your kids. They're free. You don't really have to worry about paying for anything, and you're bonding with your children, which is so important, and you're making them smile every day. A smile every day takes away the stress of what's going on right now. And then also let them journal. Let them journal their events for Easter. I remember when I was in the classroom so many years ago, and even when I was a principal, I used to go around and ask my teachers, What about creative writing about you going back to school? What did you do during your Easter holiday, your summer holiday, your Christmas holiday? And many of the teachers would come and say, Miss Annie, they can't write anything because they didn't have anything. They didn't do anything. They had to work. They had to do whatever they can. Parents couldn't afford it. So like this right now, you could journal it. And this could also help with their English background because of the social media thing, they're not writing English properly. So again, this can be also an educational time for them, where they're journaling their time with their family, they're enjoying their Easter holiday, and when they go back into school, they could actually have an essay to write about what their Easter holiday looked like. And besides all of that, at the end of it, like for example, Easter Sunday, for those of us who are Christians, Easter Sunday is a gathering family time. The Christ is risen, we're feeling happy, we're feeling good. Have a Zoom call. That's the way of doing things now. Zoom call with the family. Send a Zoom link to the family all over, wherever they are, whether they're in this country, whether they're outside of this country, wherever they are. Send a Zoom link and tell them, Easter Sunday at 12 o'clock, 12 in the afternoon, while we're having dinner, before we have lunch, let's all meet, let's talk, and let's talk about what we're grateful for during this time. And that's another way of bonding with our family and friends who are maybe far away from us.
All right. Well, Annie, we appreciate so much you being able to share some of these ideas with us. It has been, we have to be really honest about where we are at this time, and so some families will have to figure out ways to stay at home with the kids and keep it fun. And I can see, once crafts are involved, that's fun. Water, if it's the hose, that's fun. These are little things that we can do. Once the parents aren't scared of getting the kids dirty a bit and ensuring that they have a great time. But thank you.
You're most welcome.
All right, stay safe. And with that, we are going to go ahead and take our final break. And when we come back, we'll have our wrap up. So stay tuned.
Hola, Tony.
Hey, Kevin, ¿qué onda? ¿Qué pasa?
Nada, le vine a buscar porque necesito comprar más mercancías de vasos y platos desechables para mi tienda de comestible. Me estoy quedando sin esas cosas.
No, hombre, fíjate que desde el 15 de abril no puedo importar nada de eso. Y se me acaba de terminar todo lo que tenía hace como 3 semanas.
Oye, pero nunca has estado sin esas cosas. ¿Qué está pasando?
Mira esto. Esta es la nueva ley que prohíbe todo el uso de plásticos no reutilizables. Esos son vasos, platos, cucharas, tenedores, todo eso. Desde 15 de abril de este año no he podido importar nada de eso. A partir del 15 de enero del 2021 nadie puede fabricarlo. 15 de abril 2021 nadie lo puede vender. Y a partir del 14 de julio del 2021 si alguien te agarra con eso, te multan.
Híjole, no sabía eso. Necesito cambiar algunas cosas. Les diré a mis clientes por qué esas cosas ya no están disponibles. Gracias, Antonio.
Así es, cuídate.
If we are only as strong as our families, businesses, institutions, and the communities that surround us, then by giving businesses the power to grow, entrepreneurs the ability to expand, and by giving our families the right to own something. The Belize Bank gives you the power to build a nation, our nation. We are stronger together. The Belize Bank. Our country, your bank.
It's a fact that you can access unlimited services with Smart. Tired of being measured or cut off when you need to be connected? It's a fact that when you sign up for Smart's Plus plan, you get unlimited talk, text, and unlimited data. And it's a fact that you can sign up with your group of up to 5 members for Smart's Share plans and up to 40 members for Smart's Enterprise plans for unlimited talk, text, and data. Smart has the true unlimited plans. That's a fact. Be smart and live smart.
we're back.
Yeah, and we are just wrapping up our show this morning after a bunch of interesting conversations.
That's right. And we want to say thank you to you, our viewers, for tuning in, and those of you on Facebook who also tuned in. We know we've got a lot of people who are watching from all over the world, and for sharing in the conversation. Please be sure to tune in tomorrow as well. We will be joined by the Minister of Health and the Minister of Police to talk about the upcoming Easter and what can be expected in terms of COVID safety. We have other topics as well lined up, so you can look out for that. But in the meantime,
you can send us an email if you need to reach us at oie@channel5belize.com. You can also find us on Facebook at Open Your Eyes BZ and on Instagram at OIEBelize.
and remember to tune in tomorrow morning at 6:30 when you open your eyes.
And start your morning right.
Until then, keep your eyes,
Mind and heart open.
We'll see you soon. Enjoy your day, Belize.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.